Can you see me? I cannot see myself. I cannot see myself. Can you see me? Can you see my screen? Can you hear me? Can you hear me? Okay. Can you see my screen? But I cannot see my screen. Here is the audiological test. Can you see the screen? Okay. You can see the screen. Okay, fine. So I can continue my topic with this, but why this is so dull? I'm not sure why the picture I cannot see on my screen. Okay, today I am going to first of all I apology for my late. I've forgotten my class schedule and I was busy otherwise. Now uh, I come here to meet with you, but I'm very much sorry for my late. First of all, we want to talk the audiological tests. Previous classes, we have discussed some features, some clinical presentations of ear diseases like deafness, otalgia, vertigo, tinnitus, oral discharge. These are the symptoms of ear disease. Now we will talk something about the audiological tests. Audiological tests means the tests that help us to see the hearing status of a patient. I cannot see myself. I'm not sure what is the issue here or there. So, audiological tests for the hearing status, we do some clinical tests during the clinical examination. We do some form of the test using the tuning fork. Tuning forks are the metallic fork that we strike on a hard object so that it can ring, it can produce the vibration, and this vibration can be seen with the normal ear. And we can put our tuning fork over the nested process to test the bone conduction, and we can put the tuning fork over the in front of the ear to see the air conduction. Now only 16 people are present with us. We are live 3.5 minutes. Only 16 people are here. Where is my other participants? Sazin Haq, Tauhidul Islam Sharon, Shanzida Anjum, Jawad Hussain, 19. Now it is 19, including me, Anika, Aisha Tasmiya, Faria Haq, Faiza Rumi. Okay. Now it is 18. Only 18 are participating here. Why? Why the rest of the students are not participating in this class? Due to the summer heat, we are we have decided to take this class in the online forum so that you can enjoy this class while you are sitting in your room, so that what our warm of our environment cannot do any harm of you. But I am giving you the opportunity to take rest. You are taking the rest. You are not participating in my class. Only 17. Now it is 19. Why? This class should have 50 people, 50 students in my class. So we hope that you 50, all of you will present here. As there is no bar, Ifadul is present here. Thank you, Ifadul. You have absent in last three classes. Today I see you, and I am very much happy so that you are present here. And I hope that you will remain present in this class. Okay, 19, just 19. How many participants are here? I want to see the participants. I want to see the participants. Only 20. Only 20. Okay. Okay, if you have any question, let me know in the chat box. I am opening chat box in my right side of my screen, but I cannot see myself on the screen. I'm not sure where is the problem. Mm, Can you see my screen? The audiological tests, the audiological test that is used in the audiology or the PTA. The full name of the PTA is the pure tone audiometry. There are different forms of audiometries. One form is the pure tone, the audiometry that uses the pure tone for the test material. The pure tone, we use the tuning fork. The tuning fork also produces the pure tone, but we have no objective uh, markers where we can mark the finding of the pure tone status. For this region, the pure tone audiometry is a test that done in the laboratory. That means hearing test is done in the isolated room where there is the insulation of the sound from the outside, so that there is no noise cannot make any disturbance in the test. So pure tone audiometry. Another test is the impedance audiometry. In the pure tone audiometry, we will let you see what are the topics of the pure tone audiometry. Here is the graph. We can see a graph. This graph is the graph of pure tone audiometry. In this graph, we can see the hearing status of the right ear. We will let you know how can we interpret this result of this test. So pure tone audiometry is an audiological test. Another audiological test is impedance audiometry. Here you can see the image of impedance audiometry. Uh, Impedance. Here is the impedance. This is the test result that is um, done over Mr. Sajjad. Here we can see that there is a graph. Uh, there is a there is a graph, and there is no graph. There is two ear, right and left ear. The two ear has two different findings. This is the impedance audiometry. We will let you know how do we interpret this finding of the impedance audiometry. And there is the reflex test. You see the test name of the tests. The SRT. This is the reflex test. SRT means the stapedial reflex threshold. These are the audiological tests. Now 25 people are here. Faisal Hussain, Faisal Hussain, and Sumaya Mariam, all of our present here. Nabila Siddiqa, roll number 11. Rabiul Muhammad Islam. Okay. 24. Now it is 24. They are coming and going. Okay, these are the audiological test. SRT means the stapedial reflex threshold. We give the sound to the ear, and stapedius muscle is present in the ear. Can you see the stapedius? Here, here you can see the stapedius muscle. This stapedial muscle um, uh, after having exposure to a loud sound in this tympanic membrane, and the air needs some protection. This stapedius muscle makes a contraction when there is the exposure to the loud sound. This is a reflex activity. Loud sound to come to the ear, and there is a reflex contraction of the stapedial muscle. That is known as the stapedial reflex. In which sound this type of reflex is seen, that is measured in the stapedial reflex threshold. And other three investigations you can see here: OAE, ABR, ASSR. These are the audiological tests, but these are the physiological tests, some electrophysiological tests. That means electric activity is measured. Uh, Autoacoustic emission. In the autoacoustic emission, auto means air, acoustic means sound. When air is exposed to the sound, there is an emission. OAE. E means emission. When air is exposed to the sound, that means auto, exposed to the acoustic stimulus, auto acoustic, there is an emission from the inner air that is measured in the air canal. That is auto acoustic emission. And ABR is one form of the electrophysiological test that is measured over the brain surface. ABR means auditory brainstem brainstem response. ABR means auditory brainstem response. It is measured over the brainstem. That means brainstem is not directly exposed to the surface. Brainstem is situated in the near the foramen magnum, through where the middle oblongata passes from the skull base to the vertebra. The midbrain is the part of the that area. Yeah, the auditory brainstem response means when auditory uh, sound is given to the ear, there is a response to the Brishti Shurovi has deleted the message. What was the message? I'm not sure. Now 22 people, only 22. It is very sad. ABR is the when there is the response of the brain stem in in exposure to the sound. The sound is exposed to the external canal. This sound is transmitted to the middle ear, then go to the inner ear, then go to the cochlear nucleus of the brain stem. In this part, there is some physiological response in the brain stem. The response of this sound on the brain stem is measured over the surface of the skull. That is the auditory brainstem response. And finally, there is another test is present here, ASSR. That means auditory steady state response. These auditory steady state response are the cortical responses. That means the cortex of the brain is remain in the cerebral hemisphere. When there is the sound comes to the ear that transmit through the auditory pathway, and it reaches to the auditory cortex. In the auditory cortex, there are some responses. These responses are measured over the surface of the head. That is known as the auditory steady state response. These responses are on form of the brain wave that is measured um, in the the test. That's done in epilepsy. The No, I cannot recall the test. Can you help me to recall the test? What is the test done in the diagnosis of epilepsy? In the brain responses, the brain waves that is measured on the surface of the brain. Can anyone recall the name of the test? No responses at all. That is the okay. Fine, I can recall it. EEZ. That is the EEZ. Easy. Yes, right. Easy test. These ASSR and AVR, these are the EEZ, one form of the EEZ. EEZ is the test of the brain when the patient goes asleep. But in these tests, we make the patient asleep as they are done in the laboratory, and auditory stimulation is given in the ear so that patient can hear the sound and what are the responses noted in the brain stem, what are the responses noted in the cortex that is measured. The brain stem, the responses of the auditory stimulus of the brain stem is measured in the ABR, and responses of the cortex are noted in the ASSR. These are the tests of the auditory system, so that we can measure the PTA, the total hearing status of the patient, from the external ear to the cortex. In the PTA, we ask the patient, we put a sound on the ear and we ask the patient whether you can hear or not, so that the patient have to hear the sound and patient have to understand the sound, then patient have to make a response. Total integrity of the pathway is assessed with the PTA. The impedance is the test that can be done to assess the health of the middle ear. Impedance audiometry. Impedance means the resistance. The resistance, that is present in the middle ear, that is measured with the impedance. So impedance test, I will ask you in my physical class, when I am present in your class, I will ask you why impedance audiometry will be done. Impedance audiometry will be done to test the middle ear environment, to test the middle ear resistance, how many resistance present in the middle ear. And PTA, that means photon audiometry, is done to assess the integrity of the total pathway of the hearing. That is the difference between the PT and impedance. And SRT. SRT is to see the function of the facial nerve, especially facial nerve, as because the stapedial muscle is supplied by the nerve to stapedius. The nerve to stapedius is the branch of the facial nerve. So the auditory pathway through the ear, the sound is transmitted through the auditory pathway as the eighth nerve, and it goes to the nucleus of the seventh nerve. From there, the reflex will pass through the seventh nerve to the nerve to the stapedius, and there is the contraction of the muscle. So this is used to test the function of the facial nerve as well as the function of the stapedius muscle, and overall integrity of the hearing. This is the function of uh, sorry, SRT. This is the function of SRT. So PTA for the integrity of the hearing pathway, impedance to test the resistance in the middle ear, and the impedance SRT to measure the facial function. Now the ABR. So ABR to test the pathway up to the brainstem. Up to the brainstem, what is the scene? What is there any problem in the pathway up to the brainstem? And ASSR is the test to measure we assess the pathway from the cochlea, from the external canal up to the cerebral cortex. And one thing is missed, there is the OAE. My question to you, what is seen through the OAE? Why the test OAE is done in the audiology? It is my question to all of you. So I hope that you will able to ask the answer of the question why PTA is test is done, why impedance audiometry test is done, why SRT test is done, why ABR and why SSR. And I want to make you the homework why OAE is done. Why is done? Why OAE is done? It is my homework, and you can see, you can go through some literature. Some literature. I will give you the link. The link of the literature. Here is the JPKMC JPKMC journal. Here you can see the volume to number 2 of this issue, and here you can see the neonatal hearing screening program. Here is an neonatal hearing screening program. You can go through this link. Neonatal hearing screening, universal neonatal hearing screen, a comprehensive review. You can go through this. I am sending you the link here. So, oh, how can I do this thing? How can I do this thing? Oh, oh, boy. I can give you the link. You can see, go to here and you can read something about the, okay, or to measure the hair cell function. Okay, it is your homework to read it out and to see it. What is this? Now, can you see me? Can you see this screen? Where is my live? Can you see this screen right now? Okay. These are the audiological tests. Now some tests on the vestibular system. Some tests of the vestibular systems are electronystagmography. That means the ENG, electronystagmography, or VNG, that means video nystagmography. Video nystagmography or electronystagmography. These are the tests to test the vestibular system. Nystagmography. Can anyone make the can you anyone tell me what is nystagmography? What is nystagmography? Can anyone? Okay, okay. Nystagmography is the test that is done to measure the nystagmus. So, what is nystagmus? What is nystagmus? Nystagmus is an ocular movement. That is ocular movement, not the ear. Pathology in the ear, but we do the test on the eye. So that is nystagmography. Different forms of nystagmography, electronystagmography, and vestibular nystagmography, and some non-vestibular ocular tests. So issues that why I'm talking this thing, that ocular tests. Some ocular tests are directly related to the vestibular system, and some ocular tests that are not directly related with the vestibular system. They are the ocular pathology of ocular system itself. and some are directly related with the vestibular system. These are the tests that means saccade, smooth pursuit or pursue movement, smooth pursuit or pursue movement, saccade, and another test. There are many tests. Smooth pursuit, saccade, and another test. Now I cannot recall this thing. There another test, and some position tests, and finally the caloric test. Previous day, or nowadays, we can ask you in the short note, write a short note on caloric test. These are the tests. Nystagmography, that means the most of the test uses the ocular system to assess the vestibular system. As the vestibular part of the ear, the ear has two units. As the vestibulocochlear nerve, the name of the eighth cranial nerve is the vestibulocochlear nerve. So vestibular part and cochlear part. These tests, these tests, PTA, impedance, SRT, OAE, ABRS, all things are done to assess the cochlear function. But cochlear function and it is very easy to assess the cochlear function to put a sound on the ear and to see the response. Put a sound on the ear to see the response in the ear canal, to see the response on the middle ear, to see the response on the brain stem, to see the response on the higher cortex, to see the response on the behavior. So all the things, the auditory stimulus is put on the ear and see the response in different levels. These are the basics of audiological test. But vestibular system is not on our reach. We cannot directly stimulate to find out how well your inner ear and cochlea works. Okay, that is the OAE. OAE is different issue. I have given you a link, and the literature is this is the review article, and this review article is directed to see the current knowledge of the neonatal hearing screen. It is not today. I'm not talking about this, but I will talk it in future. Go through the article and read over the article. The neonatal hearing screening. In the neonatal hearing screen, what are the tests we will use, so that you will be able to learn a little bit more about the about some audiological tests. Okay, I'm talking about that audiological the vestibular system is not to our easy reach. We cannot directly stimulate it. We cannot directly see the response of the vestibular system. It is not very close to us. It is a, a little bit far away from our intervention. So how can we assess this vestibular system? There's a problem that vestibular system is related with our balance, but there are other systems also related with our balance, as the visual system. I can leave you in a dark room, or I can I can allow you to walk while I I make you close your eye with the cloth sheet, so that you cannot see the what is happening in your front. In this situation, are you able to walk in the unknown area? I think no. And this is as because this visual system is directly related with our balance. The vestibular system is related with our balance. The visual system also related with our balance. And another system is related with our balance. What is the system? Okay, I will talk you with this topic in the classroom. I think next week we will meet you on the classroom, and I will talk in more details about these tests, about the basic of the test, physiology of the test, and how this test is performed, and our issue how to interpret the findings of this test. Here is a test. How can we interpret this thing? uh, here is another thing, here is another thing. How can we interpret this thing? And this is the way how can we do the tests. Okay, I will talk you in the next class. So I want to I want to conclude my session right now. And what I am talking, I'm not seeing myself on the screen. I'm not seeing myself on the screen. So it is very blind procedure. I'm doing the blind procedure. I am just talking with myself. I'm just talking with myself, and I see on the screen there is 28 people in here. 28 people in here. Why the rest of the people, Sajin Hawk and Rodeshi? No other guys here. What is happening? I can to see the participants. Only two participants. I can see the two, three. Muhammadun Islam. Where are the participants? Only three participants here. Only three. Where have the people go? Only three participants. What is happening? I can see the here is the 26 participants, but in the right side of my panel, I can see only two. Now three, four, five. Now it is increasing. Now it is increasing. 1, 2, 3, 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Now it is 15. Where are the rest of the guys? Here you can see the 26, but I cannot see the guys. What is the issue? What is the issue of your presence? Radesh, I can see, yes, you are present here, but where are the other guys? Where are the other guys? Okay, I have to, I have to make, uh, I have to make a vigilance team to monitor you whether you are present or not. It is very difficult to take the online class and to monitor you all the naughty guys. You are the very naughty people, and I have to ready a vigilance team so that they can check you whether you are present or not. While I'm talking with you, I'm not searching how many people are in the live chat or in the live participants. Now I can see a little bit more. Now 29 is present. Okay, today I will not talk anymore. I hope we will see you. I hope we will see you in the physical class next week, and you will go through your book. The book is the P.L. Dhingra, Iron Nose Throat and Head Neck Diseases. And I hope that all of you have collected this book from the online shop or any ways you can collect it. Okay, do you have any question up to this? Do you have any questions? If you have no question, do you have any question? You have no question. If you have no question, then I want to summarize my topic. Today I have discussed the topic of some audiological tests, some vestibular tests. Next day we will elaborate these tests PTA, impedance society, OE, ABRA, these are all the things, and the vestibular test, caloric test, and the nystagmography, video, and the electronystagmography. And the homework is that the why what is seen with the OAE, and second homework is about the about the I forgot this. What is the second homework? Okay, go through the literature. Hmm. What is seen with OAE? Yes, that is the homework. And second homework, I have forgotten the thing. Okay, if there is no homework, then the homework is to read the literature, neonatal hearing screening. Neonatal hearing screening. Go through the literature, the review article, go through it, and we can talk about the neonatal hearing screen. Go through the article. Thank you very much. Thank you all.